Hello, I'm Dr. Priyanka Doctor, and I'm a practicing ophthalmologist since the last 15 years with specializations in retina and immunology. Today we're going to speak of eye care, and it doesn't require any introduction. Eye care is truly important because it deals with vision, which is pretty much the most important sense we have. And the other reason this is important is that the eye actually provides a window to the body. So the eye is the only place in the body where we can actually see blood vessels, and what is happening in those blood vessels often is being mimicked in the rest of the body for diseases which affect the entire body. Very simply, the way the eye works is that light enters our eye, and the rays which kind of are going straight are bent to a certain degree so as to then fall onto the retina, which is the layer of the eye which is converting that light energy to electrical energy. That electrical energy then goes through the optic nerve all the way back to the back of the brain, where at the visual cortex, it then gives us the sense of vision. If the eyeball is too long, then those rays which are falling on the retina fall in front of the retina rather than on the retina itself, and that causes the vision to be blurry. Whereas if the light falls at the back of the retina, that is, if the eyeball length is too short, then we have what is known as hyperopia, or a shorter eyeball. So in a sense, it's like height. Instead of being of a perfect height, if someone is taller, or in this sense has a longer eyeball, then he'd have myopia. Whereas if he had a shorter eyeball, he'd have what we call hyperopia. For the most part, most of us look straight ahead, and both our eyes are apparently looking absolutely straight ahead in parallel with each other. But what is squint? Squint is when one eye appears to be looking straight ahead, whereas one eye appears to be looking slightly askew, either outwards or inwards. Squints can be corrected by surgery, wherein the muscle which is pulling the eye towards one direction is either weakened or strengthened, depending on what's required, so that both eyes ultimately appear looking straight forward. Eye exercises may also help certain types of squints, but you really need to speak to your doctor as to whether a specific eye exercise would help your kind of squint if you have one. Sometimes we get blurry vision just for a very short period of time. When it happens intermittently or just for a very short period of time, it's more likely than not either due to some amount of dryness of the eye, or it could be that there's some gunky material or some kachra in the tear film itself. What we typically find is that blinking helps the problem. And if that's so, then really there isn't much to worry about. You needn't really visit your doctor. But if you ever notice that blurry vision is just continuously blurry, it doesn't get better irrespective of what you do, then you need to meet your ophthalmologist. Why do eyes sometimes feel dry? Well, it is because of dryness. Lubricant drops, or basically eye coolant drops, would help. It's like replacing our normal tears with artificial tears. We can use this for an extended period of time. These are perfectly safe drops. The other question is, why do eyes feel itchy? They typically feel itchy because there's an allergy to something in our environment, more likely than not pollution at this point, or there might be specific allergies to specific issues that you have. You might be using cosmetics around the eye, or it could be something like a particular soap or a shampoo which is causing an allergy. Diabetes is one disease that doesn't leave any part of our body, and the eye is no exception. So diabetes can affect our retina. The cause is basically that there's less oxygen reaching the retina, and what it does is basically two types of problems. One is it causes a swelling of the retina, typically the center of the retina, and that affects the vision of that person, wherein that person can't see clearly anymore. He sees that straight lines appear wavy. And the other issue it can cause abnormal blood vessels to grow in the retina, which can leak and cause hemorrhages or collections of blood inside the eye. What this can all eventually lead to is irreversible vision loss, if it goes on to develop a retinal detachment. Reading in dim light is going to cause an eye strain and your eyes will complain. So if you've been reading either with a wrong number, I'm digressing here, but I'm talking about if you're wearing the wrong number, then you will know because the eyes will start to pain. Or if you're reading for an extended period of time in a weird posture or in dim light, then they might hurt. What it means is it's the body's way of telling you that you need to do something about it. Either you need to get the right glasses, you need to improve your posture, or you need to increase the light. For someone who's had eyes tested and doesn't have any number, someone who's young, if that person were to get his eyes tested every 2 or 3 years, that'd be fine. For anyone else who had glasses, I'd suggest an annual checkup, or if someone had a particular problem, then it might be required more often than that. The question is, how would I improve my eyesight naturally? There are certain natural foods that work great for our eyes, especially the retina. Basically anything colored, and specifically the orange color. So carotenoids, which are most seen in carrots, for example, work great for the retina. Green leafy vegetables are great for the retina. There are certain things that put you at a higher risk of developing an eye problem. If there is a family history of someone having a retinal detachment, and especially if you yourself have a high number, then yes, it does put you at a higher risk of having a retinal issue. Systemic issues that you may have, we've already covered diabetes, but for example, hypertension or certain inflammatory diseases of the body may also put you at a higher risk of getting an eye disease. The last thing is certain drugs. Certain drugs like chloroquine or TB medication can also put you at a risk of developing an eye problem, and you should keep that in mind. I'd advise contemplating LASIK surgery done only if you're above 18 years and your number has been the same for the past 2 years. If you still want to get LASIK surgery done, yes, there will be certain tests that need to get done before we figure that you are a correct candidate for it, and then you can go ahead. Glasses are the simplest way to correct your numbers. You put them on, they're not touching your eye at all. You remove them whenever you want. And in that sense, they are the safest. Contact lenses can give you very good quality of vision, but you need to have good contact lens hygiene. You need to take care of them. You have to make sure that you don't sleep with your contact lenses on. And if you're good with your contact lenses and you follow the rules that need to be applied, you could be having great vision with them and you'd be happy not wearing glasses. There are a certain subset of people where contact lenses actually provide much better vision than spectacles. And this subset is people who have really high numbers. Why is that? That is because the really high numbers, glasses actually change the size of objects as well. Whereas contact lenses don't do that. It's right on the surface of the eye, so they don't change the size of the object that you're seeing. And when I say high numbers, I mean something in the environs of over 4 to 5 diopters of power. I'd say you need to wear glasses in order to see clearly. What would happen if you weren't to wear glasses? Depending on the kind of number, if it was a slightly higher number and you were not wearing glasses, you may develop what we call a lazy eye. A lazy eye is one where the signal from that eye doesn't reach the brain at all, or rather the brain disregards the signal because that signal is not clear. It isn't clear because it hasn't been corrected by glasses. So in order to avoid a lazy eye, you should wear glasses and you should get checked routinely and make sure that it is the correct number. Our computers and mobiles are here to stay and we're going to learn to live with them. A couple of pointers for this. Try and make sure that your monitor is either at eye level or slightly lower. Maybe use eye lubricants if you have extended computer or mobile usage. try and concentrate on a distant object after looking at a near screen for a very long period of time, and this especially applies to kids. For the most part, we don't really require separate computer glasses when we're looking in front of these screens, but someone who's on this for a very extended period of time can consider doing a few things. One is try and adjust the font size on your computer, try and reduce the brightness a bit unless there's an eye pathology or an eye disease which requires you to have the maximum amount of brightness. You can use glasses which have anti-reflex. They reduce the reflection to some extent. We also have what are now known as Blu-ray blocking glasses, and they are shown in some studies to help our photoreceptors. Everyone eventually will get a reading number. Those that have a distance number will then have a separate near number. Those who have never worn distance glasses over the age of 40 will start getting a near number. As I say, it's welcome to the 40s club. So the reason this happens is that our eyes have this inbuilt mechanism to change the number, to change the focus from distance to near. It does it by actually changing the power of our internal natural lens. And what happens with age is that power of focusing or changing the number decreases with age. It reaches a point at the age of 40 where you start requiring separate numbers. And as your age increases, that difference in number will increase with age. So whereas you need only maybe a 1.25 power at the age of 40, you would require something like a 2.75 power at the age of 60. The most common cause of eyes that are watering all the time is a number that hasn't been corrected clearly, or because you're not wearing glasses. It's the eye's way or the body's way of telling you that you need to be doing something about it. Of course, there are many other reasons. It could be that we have a drainage system in the eye where the tears kind of drain into the back of the nose. And if that is blocked, it can cause excessive watering. Watering may also be due to an infection of the eye or an allergy of the eye. Tiredness and heaviness might be because of dry eye. You need to use more lubricants. Or it could be a number that has again been uncorrected or not been corrected correctly, and you need to check your glasses. The most common cause of a chronic headache is an eye number. So yes, you definitely need to check your eyes if you have a chronic headache. There are other eye causes of a headache, such as if your eye pressures are on the higher side. And then, of course, there are many reasons why you may have a headache which has nothing to do with the eyes. So I'd say the first thing you need to do if you have a long-standing headache is to get your eyes tested. However, if you've had a headache only since you've had a fever, or if you know you have sinus issues, how would you know you have sinus issues? Typically, you have a cold along with it. Then you know that it's more likely to be because of a sinus headache or an upper respiratory tract infection. If, however, you have what I would call a never felt before kind of headache, then please meet a physician. It could be something which is more ominous. It could be something to do with the brain. We have glands around the eyes that produce secretions, and sometimes those glands can get blocked. The pores through which the secretions come out may get blocked. If we want to liquefy the solidified secretion, then we typically ask the patient to do a warm compress. When would I know that I need to do a warm compress? If you are getting a swelling around the eye or feeling a little uncomfortable around the eye, especially in the morning, I'd be advising a warm compress. If, however, you've had an allergy and you've got a swelling around the eye which is itching, then I'd typically ask you to do a cold compress. If you've had any trauma around the eye and it's swollen because of getting hurt, I'd be asking you to do a cold compress. For the most part, a good balanced diet takes care of our eyes. There's nothing specific to be done if we have a good diet. But As I said earlier, what I would suggest is colored fresh fruits and vegetables. Those definitely help, and green leafy vegetables. The other thing to keep in mind for keeping eyes safe would be for people who are taking part in contact sports. So for example, squash or football. For those kids, I would suggest using what we call polycarbonate glasses. It's a type of plastic which is much tougher than regular plastic, and it's always a good advice to have these on while playing these sports. You may have seen certain people who have like a skin growing on the surface of the eye. We call it a pterygium, or a small little bump on the surface of the eye, which we call a pingicula. And one of the risk factors for those conditions is UV rays. So it is a good idea to wear UV protection. The other subset of people who benefit from UV protection are old people who are prone to develop what we call age-related macular degeneration. And UV protection helps to prevent the progress of that. Our natural eyes have a transparent lens within it, and what that lens does is it refracts the light which is entering the eye, or it bends the light which is entering the eye to a particular angle so that it falls on the retina. As long as that lens is transparent, we can see everything. But when that lens becomes opaque, then it has developed what we call a cataract. It prevents that light from entering the back of the retina, the back of the eye onto the retina, and that then causes visual loss due to cataract formation. So the natural lens is actually like a bag of protein, and I'll kind of compare this with the white of an egg, which is actually transparent, but it's only when we put it on a tawa or put it on a pan that it turns white and opaque. Similarly, the natural lens is actually a bag of protein which is transparent. It's transparent protein. But because of age-related changes, it has denatured and become opaque. The way to treat a cataract that has formed is to surgically remove that lens and put in an artificial lens. We call it phacoemulsification. It's surgery that is done through a very small incision. The incision size is about 2 millimeters, and we put in a little instrument which kinds of breaks that lens into little parts, sucks it out, and then we inject an artificial lens into the eye. As such, this is a very safe procedure, and we do it with what we call topical anesthesia, meaning we have just used drops in order to complete this surgery. No, eye exercises are not going to help you get rid of your numbers. You have a number because your eyeball length is either too long or too short, or the front of the eye, instead of being a perfect sphere, is more like an egg. It's kind of elongated in one direction. So no, eye exercises are not going to help to change that. Is it safe to sleep wearing contact lenses once in a while? No, absolutely not. You absolutely should not be sleeping with your contact lenses on, and that is because you need the oxygenation of the eye, which is below the contact lens, and this is what happens when your eyes are open all through the day. However, at night with your eyes shut, that oxygen cannot reach the surface, and it's a definite no. You will damage your eyes if this happens. The other tips for basically contact lens use is that you need to have it in the correct solution, which needs to change on a daily basis all through the night. You shouldn't be wearing it for a very, very long period of time. You can wear it through the day, but you shouldn't be doing a 24-hour, for example, with your contact lenses on. And once in a while, we have what are known as enzyme cleaners, and these can be used to clean the contact lenses. If, however, you're sleeping for an hour or two in the bus or the train when you're commuting with your contact lenses on, that should be fine. When a dust particle enters the eye, the one thing everyone tends to do is rub the eye. And the one thing that you shouldn't be doing is rubbing your eyes. What that may do is actually embed the particle or make it go deeper within the surface of the eye. So what can you do? Try and blink That's perfectly harmless. The eyelids work like wipers so as to remove muck from the surface of the eye. If the particle doesn't go with that, you can try using lubricant, see whether that will kind of soften the embedded particle or the particle that's only on the surface and wash it away. If that doesn't work, please meet your ophthalmologist. No, there's no real way to avoid getting glasses. If you need glasses, it's because your eyeball length is not perfect or your corneal curvature is not a perfect sphere, and you need to be wearing those glasses in order to be seen clearly. As long as you can vouch for the cleanliness of the water that you're using to splash on open eyes, that should be fine. For the most part, you don't really need to. We have our tear films for a reason. Our eyes are bathed in that tear film, and our lids make sure that that tear film remains of the same thickness all through the day. The tear film provides nutrients to the surface of the eye, provides moisture to the surface of the eye, and prevents dryness. The splashing of water really isn't required. Eating carrots and other fruits are definitely helping your eyes. It's keeping your eyes healthy, but they're not really removing your numbers. Well, so I hope I've left you with some tips to keep your eyes healthy, and I hope you've taken some messages from this talk. Thank you.